been going to Kenya on and off for the last 10 years or so, and over that time I've been heartbroken many times with the things that I've seen. The level of poverty is like nothing I've ever seen before. It is just completely oppressive, and it's so often the difference between life and death. You know, people really do on the villages live on the line, and too often I've seen people pass away for ridiculous reasons. You know, they didn't have enough money to get on a bus to get to a health clinic, or that they didn't have enough money for whatever. You know, life is very fragile, I think, in sub-Saharan Africa, and that's what drives and inspires us. Hi, my name's Jess, and I've been involved in Positive Aid since we started in 2007. I'm currently the president of the organisation, and we began Positive Aid with the primary purpose, I guess, of empowering developing communities in Africa. We initially started by focusing on HIV/AIDS, and over the years, as we've grown as an organisation, we've been able to provide support to increasing number of activities. So we now support things like maternal and child health, poverty alleviation and livelihoods, and some other things as well.
My name's Lilian Austin, and I am the current Vice President of Positive Aid. I think one of the really nice things about Positive Aid that's really powerful is that we focus very much on the local communities in Kenya, enabling them to find their own solutions, to learn through the process of doing that, and to develop skills and abilities within their local community. So in the area that we're working in Kenya, there's about 100,000 people who live in that area, and some of it's quite remote. So part of the program has been to train community health workers, and we've trained about 100 of these people, and they go out and visit the very remote villages. They meet with the people who are sick and who need assistance. One of the things we've been able to do with those community health workers is to provide them with bikes to be able to go out to these villages, but also when they had someone who was very ill and needed to go into a hospital to get medication, etc., they were often too unwell to walk the long distances to the hospital. So the bikes have been used to dink the sick people. These very sort of concrete things that you can see your money going into, and you know that it's made a big difference. That area with 100,000 people is now serviced by some sort of medical care, and knowledge is being given to these people to help their own lives.
Positive Aid focuses all of its activities on Africa, and particularly in Kenya. I think it's ironic that Africa in general is usually termed the dark continent. It has a lot of troubles, of course, and often it's labelled as a basket case. You know, it has so many problems that, you know, people don't even know how to tackle it, basically. But in my own experience, having lived for a lot of time in Africa, it's actually quite the opposite. It's a very vibrant, energetic place. The people are very strong, very inspiring and welcoming. And I think that there's so much potential for really true development to take place, and that's why I'm so thankful that Positive Aid as an organisation is able to come in and partner with local African organisations, and we're achieving really fantastic things through our development efforts. And if we can impact in a really positive way, then we've done our job, and it should take place at the grassroots level, not in Australian offices, but there on the ground in Kenya.